Hi, my name is Anais Payo. I'm going to talk to you about earlier delayed cardioversion and recent-onset atrial fibrillation. Definition. Atrial fibrillation is a condition of irregular rapid heart rate that occurs when the two upper chambers of the heart experience chaotic electrical signals. Immediate restoration of sinus rhythms using cardioversion is commonly performed, but if immediate cardioversion is necessary or not is known now.
Your heart is a muscle that pumps blood around your body. It's made up of 4 chambers, 2 at the top called the atria, and 2 at the bottom called the ventricles. Your sinus node sends out electrical impulses. Atrial fibrillation, or AF for short, is when other areas of the atria send out electrical impulses too. These irregular impulses cause the atria to twitch. When this happens, blood isn't pumped out effectively, which could cause a blood clot to form. If this clot travels to your brain, it can lead to a stroke. When your heart isn't pumping blood properly, it can lead to symptoms such as tiredness, dizziness, or feeling faint, shortness of breath, or palpitations. How AF affects you will determine the treatment you need. Some people with AF, like Harry, only have mild symptoms or may not experience any symptoms at all. Harry noticed something might not be right when he felt his pulse was irregular and sometimes fast. Harry was at higher risk of AF because of his age and high blood pressure. Those with a heart valve problem are also at a high risk. It's important that Harry avoids further strain on his heart by getting treatment for his AF to reduce his risk of stroke or heart failure. The best course of treatment for Harry was anticoagulant medicine, called warfarin, to reduce his risk of having a stroke, followed by a cardioversion, to try and restore his normal heart rhythm. However, some people may need other treatment, such as ablation or other suitable medication. Thanks to his treatment, Harry's AF is manageable and he can return to work and exercise when he feels ready. For more information on living with atrial fibrillation, visit bhf.org.uk/AFib. BHF. Beat heartbreak forever.
Application in medicine. Atrial fibrillation is one of the most common arrhythmias affecting about 2.3 million adults. Men, especially those of white ethnicity, are more likely to develop atrial fibrillation than women, and individuals of black ethnicity. The prevalence increases with age, and almost 10% of people 18 years are affected. The most common causes of atrial fibrillation are hypertension, coronary heart disease, cardiomyopathy.
Dr. Hanna, what's your feeling about cardioversion and nodal ablation?
Cardioversion, I think that if you have somebody with paroxysmal atrial fibrillation, everybody, gets a chance at trying to achieve sinus rhythm. I think that some patients with cardiac amyloidosis, no matter what you do, you can't just keep them in rhythm. You're getting cardioverted every couple weeks. The one thing I would say about cardioversion, there was a publication showing increased risk of thromboembolism And the fact is that even in sinus rhythm, patients who have a lot of amyloid filtration in their atria can have such poor atrial function that, for example, on mitral inflow, you barely see even an A wave. There's been documented that you can have atrial thrombus in normal sinus rhythm, or for example, when they're in AFib and you have them adequately anticoagulated for a period of months, well above what you would consider needed, that you wouldn't need a TE anymore. We're now recommending that patients get TE even if they're adequately anticoagulated, because there's a percentage will still have persistent atrial thrombus. It's just, the CHADS VAS score, the CHAD score does not account for the very high risk of atrial thromboembolism that you see in cardiac amyloidosis. As far as, did you say ablation?
Yeah.
Yeah. So as far as ablation, atrial fibrillation, we actually looked at that at our institution at atrial fibrillation ablation. The kind of the consensus before we started doing that was, look, the likelihood of this being successful is very low. There's a lot of amyloid, there's a lot of scarring. And so we're going to be putting people through a procedure that's likely not going to work. And one of our EP fellows actually looked at our patients who underwent atrial fibrillation and then propensity matched in 3-to-1 with propensity matched patients with AFib who did not get atrial fibrillation, and actually showed that they had significant reduction in atrial fibrillation burden and actually a mortality benefit. Now that's a very hypothesis generating publication study, but I think in my typical elderly patients had long-standing AFib, and they're very advanced. I don't feel that in general I wouldn't pursue an atrial fibrillation ablation. I think if somebody who has paroxysmal AFib or and really doesn't tolerate AFib well, I think it's not completely unreasonable to consider an atrial fibrillation or pulmonary vein isolation.
Pros and cons. Pros: spontaneous conversion and delayed cardioversion reduce the need for immediate pharmacology or electrical cardioversion. Electrical cardioversion shortens the time until conversion. A potential advantage of shortening the time until cardioversion will be early elimination of symptoms and prevention of heart failure, syncope, cardiac or cerebral ischemic events, or progression to persistent atrial fibrillation. Cons: delayed cardioversion with longer time. Speed in atrial fibrillation could prompt stroke with time. Guideline said initiation of anticoagulation is expected to reduce the risk of stroke. UC applied in Ecuador. Prevalence of AF in other Americans living in rural is long, but partially determined. Short stature and frequent dietary oily fish intake might explain the long prevalence of AF in these rural settings. According to data collected by the National Institute of Statistics and Census of Ecuador in 2014, a total of 4,430 deaths from AF were reported. And conclusion. Atrial fibrillation is an irregular atrial rhythm which can be episodic or continuous. Paroxysms or tachycardia might occur. To prevent atrial fibrillation, it is important to have a healthy life to reduce the risk of heart disease. A healthy lifestyle can include following a healthy diet for the heart, increasing physical activity, and avoiding smoking.
Hi again. So it's me again, Dr. Gymnatis with Cardiovascular Interventions, and I hope you all are enjoying the series. Today I'm going to tell you about cardioversion. Cardioversion is when we give a patient an electric shock and bring the heart rate back to normal. And it's usually indicated for atrial fibrillation. So these patients usually have to go to the hospital, but I do this right here in my office. The patients come in here in the convenience of the office setting. We do the blood work, chest x-ray, then we bring them here and we attach the pads to the chest, and then we deliver an electric shock. Of course, before we give them the shock, we give them a little medication that basically puts them to sleep for about 30 seconds to a minute, sometimes 2 minutes. And then they wake up and then they go home. They have to go home with a ride. So electrical cardioversion is really important when a patient is having a runaway heart rhythm such as atrial fibrillation, very fast heart rate, or any other rhythm that will respond like atrial flutter. Usually they're on a blood thinner, and they have to be on a blood thinner for a full 1 month before we do the procedure. So we check the blood tests as well, make sure everything is okay, bring them down here and deliver the shock. This particular patient happens to have a pacemaker as well, and then we always interrogate the pacemaker through this pacemaker interrogation device to make sure it has not been affected by the shock that we've just delivered. Of course, it also helps me to interrogate the device and look at his underlying rhythm. Sometimes I can even give the shock through a defibrillator. If they already have a defibrillator in them, I can deliver the shock through the defibrillator instead of externally. So it's a very safe procedure. We have a full staff over here available, and usually they wake up not even knowing that we did the procedure. So this is what a cardioversion is. In case you ever have to have somebody have it done, you'll know and be educated about it. So I hope you're enjoying this series. If you like this video, give me a thumbs up and do follow our channel. Take care.
Thank you.